I am a survivor. I am Jules, wellness warrior. Cancer, you picked the wrong chick. I am 8 months out of chemotherapy. I wanted to share with you 5 quick tips for surviving chemotherapy. 5 quick things maybe your doctor didn't tell you. 5 things on how to prevent further illness or disease or complications during chemotherapy. So I wanted to put it in this video for you, as I'll be sharing many other ones. First of all, I just wanted to tell you, if you're watching this, chances are most likely that you are diagnosed. And for that, I am very sorry, but I wanted to share with you hope, and I wanted to share with you tips on how to survive, and so the chemotherapy won't be so rigorous, or it won't be so hard on your body, or it won't be so full of complications. These quick tips that I found, that I researched, they helped me to prevent further illness and further disease and how to basically survive chemotherapy. So I wanted to share them with you. And first of all, I was diagnosed with inflammatory breast cancer, stage 3B. And so the chemotherapy that I went through was rigorous. I was at the doctor's office all day from about 9 a.m. to 4 p.m. receiving treatment. So I understand that it's tough, and I understand that it's a hard process to go through. I will be posting the names of the chemotherapy that I went through because it's really hard for me to pronounce them. And I just wanted to make sure that before you do any of these tips, you talk to your doctor. This is not me trying to push them on you. This is just tips that I learned. I researched, I Googled. I was really adamant about finding ways to keep myself healthy during treatment. So one of the things I just wanted to share with you is that chemotherapy is very hard on your body. It attacks your fast-acting cells. And so you're already fighting this battle of cancer, and you go through the chemotherapy, and what it does is when it attacks those fast-acting cells, of course, as you know, it attacks your hair. And a lot of people, understand that, but what you didn't understand was that it also attacks your entire hair of your body, all the follicles of your body. So that's what I wanted to focus on, these quick tips. These are 5 things that I did during chemotherapy every 3 to 5 hours to maintain my body's health and to prevent further diseases. So number 1 is, we're going to start from the top and go to the bottom. Number 1 is your eyes. Because the chemotherapy attacks your fast-acting cells, it attacks your eyebrows, and your eyelashes. And so I didn't even think about this. So what I did was I got eye drops, okay? If you wear contacts, do not wear your contacts during treatment, because your body can get dried out, your contacts can stick to your eyes, you can get a lot of complications or a lot of bacteria in there. So I got eye drops. I got re-wetting eye drops for my contacts when I wore my contacts outside of treatment, but I also, I got just different brands. So you can get whichever brand you're comfortable with, but what I did was I applied the eye drops every 3 to 5 hours. So I even put an alarm on my phone. I applied this, and it helped me so that I wouldn't get any infections. And it was funny, I remember after treatment, I had lost my eyebrows, I had just a few eyelashes, and I was sitting underneath the ceiling fan, and all of a sudden my eyes just started watering and burning and hurting. So your eyes do get more sensitive during treatment. Some people who lost their entire eyelashes, to prevent infections, they would use Johnson's baby shampoo just to keep the area cleansed. I didn't, however, but I wanted to share that tip with you. Make sure that you're keeping your eyes protected. Make sure that you're preventing any, infections around the eyes, because if you get an eye infection, that will be really painful and cause for other things that you just don't need during treatment. So that's number 1, your eye drops, okay? So number 2 is your nose. And I didn't even think about this either. Because you lose all of your hair, guess what? You lose nose hairs. And I would think, well, what's the big deal? But trust me, it can lead to complications. Because you don't have the hair, protecting the membranes, the nasal cavities in your nose, you can get, a few things could happen. You could get a runny nose all the time, or you could get dry nose, which could lead to bloody nose. So you want to make sure that that's lubricated and protected. So what I did was I used saline drops, and my nose was so sensitive during treatment. I did not want to squeeze this up my nose. So I would just get, a little Q-tip and just put it up in my nose, again, every 3 to 5 hours. This helps so much from any infection. A lot of girls I know who went through treatment, sometimes they would get scabs up in their nose, they would get dry nose, runny nose. So you just want to make sure that you're protecting that. Also, if you do get scabs, if you do get bloody noses, if you do have complications, I would get, this is Neosporin First Aid Antibiotic Cream. Okay, so it's not Neosporin, it's Neosporin cream. And it just helps the inside of the nose, protects it so that you don't get any, injury, any infection, anything else or any other complication during that time. Okay, so number 1 is eyes, number 2 is nose. We're gonna go down to the mouth. This is a big one. You want to prevent sore throats and thrush. You want to prevent mouth sores. You want to prevent cavities. So every 3 to 5 hours, I was on this regimen for my mouth. Things taste different when you're going through chemo. You might, something that you loved before, you don't. Using utensils, I mean, it's just the weirdest thing. Your taste buds change, your mouth changes during chemo, and you want to make sure that it's clean and protected and preventing it from any injuries or infections. That's a big one. So I use biotin, okay? It's funny how if you use toothpaste or mouthwash with alcohol, it'll sting and burn your mouth during chemo. I don't know why, it just does. So I got biotin, okay? Toothpaste and mouthwash, okay? This is a saver because you could still rinse out your mouth and you could still brush your teeth, keep it clean, but without getting that irritation. Another thing I did was I used, those electric toothbrushes, and I changed them about every 2 weeks because I just wanted to make sure that my mouth was clean and prevent any infections. I also used, a scraper for my cheeks, for my tongue, because I didn't want any bacteria going in there, getting any infections or opening the door for any diseases, any sickness. I mean, you don't understand. Chemotherapy just strips you of your immune system. So infections that you might have never heard of, you could get during this time. So you want to make sure that you're preventing that. Another thing I did was this little concoction, this little rinse that I rinse my mouth out with beyond the biotin. Okay, so I'm going to show you. I'm also going to put this at the end of my video. I got a little cup of warm water. So half a cup of warm water, 1/4 teaspoon of baking soda, 1/8 teaspoon of salt. So I would mix this together and I would gargle it and rinse my mouth out with it for 30 seconds every 3 to 5 hours to keep my mouth clean. At first, it might be gross, might be disgusting, but trust me, it is worth not getting mouth sores, not getting cavities, and continuing to keep that area clean. No mouth sores. That's a big one. I hear this a lot, that people get mouth sores. When you get a mouth sore during chemotherapy, it can last for 1 to 3 weeks, and it is very painful. So I'm happy to say, doing this formula, I did not get any mouth sores. So I wanted to share that with you. Also, if you already floss, continue to floss. But if you don't floss, don't start, because you don't want to have bleeding gums. Okay, so number 1 is eyes, eye drops. Number 2, nose drops. Number 3, mouth care. Number 4 is your nails. I loved my acrylic nails. Some people have mixed feelings about this. I decided to take my nails off during chemotherapy because I didn't want to, again, have that open door for infection, someone else doing my nails and using all the chemicals or, using all the tools. I didn't want to get an infection. Also, the type of therapy that I'm under could cause my fingernails to turn black, to fall off. Same thing with my toenails. So I didn't want that to happen. So what I did, again, every 3 to 5 hours, this is what I used. I used tea tree oil. So I would get the tea tree oil with a Q-tip and just rub it on my cuticles every 3 to 5 hours. Same thing with my toenails. Now also, sometimes the tea tree oil can kind of smell really strong. So if you're sensitive to that during chemotherapy, you can also I used coconut oil too. Sometimes when I just didn't feel like smelling the tea tree oil, I would alternate it with coconut oil. Again, just rub it all on your cuticles to make sure that they're staying intact, to make sure that they're healthy, to make sure of the growth. Some people use cuticle oil of other brands, but I just wanted to use something more natural. So it's up to you, whatever you want to do. And I'm happy to say again, I did not lose any fingernails, any toenails during this time, because trust me, it happens. I didn't have any, dysfunction in the nails. I didn't have pretty nails, but they were on and they stayed intact. So number 5. So let's start. Number 1 is eyes, eye drops. 2, nose, mouth, toenails, fingernails. Number 5 is digestion. I'm going to get these things for you. It's so funny because, again, when you're under all of this treatment, your body goes through so many changes. You have all these chemicals in your body, and chances are, if you are a cancer patient, they could possibly give you steroids with the chemotherapy. Also, you're on vitamin D. I mean, you're just on so many things, and your body, your liver, your kidneys is probably going crazy. At some points, I'm just going to tell you, I was constipated. At some points, I had diarrhea. So you want to keep those intact also, because one minute you could have diarrhea, and then if you let it go for the rest of the day, you could lose all your nutrients and have diarrhea and have to go to the ER. You don't want that to happen. So I got this beforehand. I got Imodium, if you want to drink it, or anti-diarrhea. I got all of these beforehand because I didn't want to be sick and have to go out and get them. So I got, anti-diarrhea. On the other hand, if you need, you can get a laxative, or you could do olive oil, a teaspoon of olive oil if you need to go to the bathroom, if you're constipated. Put this, in soup. Because like I said, some things in your body could make you constipated. Some things in your body could make you have to go to the bathroom. It's just so weird how that happens. Your body is just going through so much. So you want to make sure that you keep it protected. Okay, so here, 5 quick tips. Number 1, eyes, eye drops. Number 2, nose drops. Maintenance for your mouth, maintenance for your fingers and toes, and then lastly, 5 is your digestion. Also, just a tip on that is drink tons of water to make sure that those toxins are getting out of your body. I hope that this helped you. I always tell you, ask your doctor first, research it on your own. The thing that I learned during this treatment is I had to be my own advocate. People reached out to me, and a lot of people wanted to tell me what to do, what not to do, how to do it. But I'm here to tell you, I am your cheerleader. I am your supporter. I understand what it's like because I went through it. And I can honestly say, be your own advocate. Research it, study it. Whatever your faith is, pray about it and look into it, because you are your own advocate. You have this one body. Nobody else is going to live in it but you. And so you want to take care of it the best way you can, especially during treatment, because the chemotherapy just strips you of your immunity and your health. And so you want to do these things to prevent further infection, to prevent further illness, to prevent further complication, because, let's face it, you're already going through so much as it is. And I know what that feels like. So I just want to share, the information that I had, and just pass it along to help you guys, because these are things that I just found out on my own. And so I will be sharing, further information, a lot of information about nutrition, about, skincare, about hair care, and just about, the mental and physical, things that your body goes through during treatment. I am a survivor, and I just wanted to share that with you, that you can do anything. And during this process, you will realize how strong you are. If you're just watching this and you just got diagnosed and you might be scared, I'm here to tell you, I know what it feels like. And I'm here to tell you there is hope. You know, my diagnosis was very scary. I didn't know what to expect. And look, here I am. You know, it's been a year since I started chemotherapy and I am thriving. And I wanted to share with you, a little quote that someone shared to me when I got diagnosed. And it says, "What cancer cannot do. Cancer cannot cripple love. Cancer cannot shatter hope. Cancer cannot stop your faith. Cancer cannot destroy your peace. Cancer cannot kill friendships. Cancer cannot suppress memories. Cancer cannot silence your courage. Cancer cannot invade your soul. Cancer cannot conquer your spirit." So I just wanted to tell you, even if you're watching this video, I know that you already are an overcomer because you're searching for ways to be a survivor. You're searching for ways to help yourself, which is a great thing. Your attitude is so powerful. Your mind is so powerful. You have no idea what a positive attitude can do to help you during this treatment. So at the end of this video, I'm going to leave you information to contact me. If you have questions, if you have tips, if you just don't know what to do or where to begin, if you have a prayer request, if you'd like me to support you and pray for you, I would love to do that because I know what it feels like. It's really scary, but at the same time, there is hope and there's a lot of things that you can do to help this process be, positive and to let you know that there's hope and you can do it. So from one survivor to another, this is me telling you, Jules, Wellness Warrior, that we are about wellness. And I always said this to my cancer or the cancer that I was diagnosed with. Cancer, you picked the wrong chick, and I am a survivor, just like you. You are a survivor, you are an overcomer, and you will get through this. So hope to hear from you soon. Be looking for more videos of how to survive cancer with me, Jules, and I will talk to you soon. Blessings.